Pleasure to see you as always.
Pleasure to see you.
Get comfortable. Would you like some water?
Thank you. I want some water all the time.
Keep hydrated.
Water is life. Keep hydrated for beautiful skin.
Great. So how are you today anyway?
I'm okay, doctor.
Before you came in, I was reviewing your file.
Yes.
And I see I've known you since 2013.
13, I'm a pioneer.
Yes, we saw you initially. You were suffering from some acne.
Very terrible acne.
And we treated that. It took us quite some time, and thank you for being patient and understanding this is a process.
Yes, thank you.
I'm not here to do magic overnight, but
yes.
We worked hard at it. And at some point, I think in around 2014, we shifted over towards anti-aging, and I put you on a maintenance program for your skin, so to preserve the quality of the skin for longer. And then we started doing some more advanced things for lifting of wrinkles.
Yes.
Obviously, we all want to look young forever.
Everyone does.
And it's good that you do take the time and effort into your skincare.
Thank you.
So that brings us up till now. And I see with your regular visits, your skin is looking very, very good.
Thank you. No makeup at all.
Fantastic.
I don't need it. Just my eyebrow and I'm good to go.
Great. So in the morning it's easy, in and out.
Very easy.
Okay. So today we're going to talk about something new that I have. And I've mentioned it before, but it is something for non-surgical facelift. We all want our face to look young. And as we get old, everything starts coming down.
Yeah, shrink.
From the age of 20, 30,
gravity.
Gravity, yes, gravity. So that's what makes us old in addition to the sun.
Yeah.
So that is called extrinsic aging. And then intrinsic aging, what is within us, is we all get older. We get from 30 to 40 to 50, whatever it is. You're not there, obviously.
No.
And it's good you take care of your skin, because the more you do before, earlier is better for your skin and keeps it plump for long. So, the new treatment for non-surgical facelift is called ULTRAFORMER. Now, as we age, collagen breaks down. This is a treatment that helps stimulate the collagen to come in and lift back up and sort of lift up the cheeks, contour the neck, lift up the eyebrows, reduce your laughter lines. So there are many areas that can be treated. Actually, the same treatment can be used for treating of sweating as well.
And I love laughing. I've realized of late, over laughing is making me create these weird, are they called laughter wrinkles?
Laughter lines. Now, we can't stop you laughing. That's obviously your personality and nature. We all have that. We don't want to be serious all the time.
Yeah.
So this is a treatment that can help reduce all that.
Okay.
But before I answer any more questions, tell you any more, do you have any questions for me on ULTRAFORMER?
First question, does it have side effects?
It has there's some pain and discomfort that can happen for about 2 days. It is very mild, bit of bruising can be there from the treatment, but there are no long-term side effects.
Okay.
Some people say they've got some sensitivity that can last up till even 1 week, but it is tolerable. We've done several treatments of it. This treatment is approved in Europe, in USA. So they've done plenty of studies on it. Yes, they're comfortable.
Okay.
Plenty of studies. So yes, it is very, very safe. Obviously, if done under the right guidance and hands.
Yeah.
And we've got all that.
Okay, I have a lot of questions I need to ask because I have to know all these things before I undergo this procedure that I do not know about. I've been doing the same thing for over 7 years, like treating my acne, because before I came here my skin was really bad, so this is something new to me. Do I have, is there any possibility that after this procedure my skin is going to break out? Because that is my biggest worry. Remember my skin before for the very first time I came here.
I'll explain the procedure to you. First, we put in an anesthesia. So there's a topical anesthetic cream, numbing cream that we apply to the skin that we're treating. You sit with that for about an hour, and then the procedure starts. Now, this procedure is based on ultrasound therapy. There are no chemicals. There are no light therapy in there. So if you've ever been pregnant or in pregnancy, they look at the baby with an ultrasound scan. This is the same way. It's focused ultrasound, targeted ultrasound to heat up the different layers of the skin. So it works on the muscle, the dermis,
tightening the muscle.
Yes, tightens the muscle.
We need that.
Stimulates collagen formation in the dermis, which is a deeper layer of the skin, and the epidermis. Now, epidermis is the superficial layer of the skin, so it could technically irritate a bit of the skin, but it is not shown to give acne at all.
Okay.
The only thing you can have is a bit of bruising because there's sort of targeted heat that comes in, but that bruising normally settles within a couple of days.
With your experience, you've worked on people of different races. As an African, I know with the people that age last, like it doesn't come easy for us to age. What do you think is the beginning age for an African woman to age? Because I'm asking this because I have friends that think they're supposed to do all these things when they turn 40. What is your take on this?
Well, see, anti-aging means prevention of aging. Ideally, they say from the age of 20, 25, you should start taking care or to prevent it. Now, why in Africa, where we are, we've got a good diet, first of all, very organic food that we eat.
Almost everything.
Yes. They do like taking care of the skin. However, compared to historically when our ancestors didn't used to live till so long, that is why I used to see that the Muzungu, the white-skinned people, used to have a lot of, they used to look very old for their age when they were in the 50s or 60s.
Yeah.
Because they used to live that long. Whereas in Africa, we didn't have that life expectancy. But now that we're living that long and we are getting healthier per se, we're taking a bit better care of ourselves.
Yeah.
And you're seeing people living a bit longer. You're seeing the wrinkling and the aging effects now, more pronounced. So if you start taking care of yourself early, important to apply a sunscreen. We've talked about that.
I love sunscreen. Even when I'm not going out, I'm always applying it.
Because sun rays coming through the glass in the window will get you. Ultraviolet B will age the skin. So it is important to apply sunscreen. In terms of anti-aging, there are some things that we use in addition to your diet and drinking lots of water. What you're supposed to use your skincare program. And these are the advanced treatments that are there are just for the people who want to have that little bit extra to lift up the skin.
Amazing. So, doctor, there is a natural way people age, and there are some factors that can accelerate aging. Can you take me through that?
So, aging has two parts. There's intrinsic, so within, aging from within, and extrinsic, influencing factors from outside. Intrinsic aging we can't do anything about. That is your genetics, and I mean people age faster with some genetics issues and things like that. Extrinsic aging is where we can take care. Number one, we talked about just now, sunscreen.
Yeah.
Very important to apply. Gravity. Now, as long as you live on Earth, you're not going to be able to do anything about that.
Gravity is that BITCH.
Yes. But the other thing is pollution. Now, smoking being a big factor.
Yeah.
Leads to wrinkling. Excessive alcohol consumption is a problem, and a very unhealthy diet. Lots of fast foods, what we call trans fatty acids, lack of vegetables, green vegetables especially, all these things that can lead to premature aging.
Okay.
If you take care of your diet, drink plenty of water, don't smoke, your skin will be better for longer.
You had him take a lot of water all the time.
Yes.
I have water here, I have water here, and vegetables. So, doctor, you've been earlier, you talked about working on my skin to treat the acne, to make it clear now that it's clear. But I'm naturally a very happy person, and I'm always laughing. So most of the times when I look at my face, I see I get the, what do they call them? Smile?
Laughter lines.
Laughter lines. And I'm in my 30s, my early 30s. I know very soon I'm going to have wrinkles all over my skin, and you keep telling me about a way to prevent them. So what are we going to do to help me reserve my youth?
So number one, yes, you look very good for your age.
Thank you.
Now in early 30s, we really don't want to go for any surgical options. There are the surgical options of facelift you see on TV and stuff for the elderly people. Well, we can do it with injections, something called dermal fillers. Collagen that we can inject right into the folds. However, when I look at you, and I'll have a closer look in a second, we can do something which is non-invasive, which doesn't involve needles. That can help lift up the whole face and neck.
My face.
Contour your jaw, lift up your cheeks a bit, forehead up. So it's a treatment that helps your body stimulate its own collagen. Like I said, with aging, collagen is what breaks down. We lose the volume. Elasticity. So we're going to lift it up. We're going to stimulate your body to make its own collagen naturally through a procedure we call ULTRAFORMER. That is to stimulate the body.